Welcome to our YouTube channel. Today we'll explore a selection of gentle, natural home remedies. Simple, accessible methods you can use in your own home to support your health and comfort. These are not substitutes for professional medical care, but everyday tools you can apply when symptoms are mild or as adjuncts to standard care. We'll cover remedies for common complaints like colds, digestive upset, skin issues, sleep challenges, and more. Plus, the principles behind them and cautions to keep in mind. If this kind of calm, practical wellness content speaks to you, take a moment now to subscribe to the channel. It helps us continue sharing simple, natural health education like this. Let's begin by grounding ourselves in the guiding principles of natural health. Part 1. Principles of natural, home-based healing. Address the causes, not just symptoms. A cough often arises from irritation, dryness, or mucus overproduction. Merely suppressing it doesn't always resolve the root problem. Many home remedies aim to support the body's own healing processes. For example, hydration, circulation, elimination. Use simple ingredients you already have. Herbs, kitchen staples, warmth, moisture, compresses, gentle therapies. Simplicity reduces risk of interactions or side effects. Support the body's systems holistically. Proper sleep, nutrition, hydration, fresh air, movement. These are foundational. Remedies are adjuncts, not standalone miracles. Timing, consistency, and moderation matter. A remedy may help more if applied early, or in repeated doses, than waiting until conditions worsen. Avoid overuse or overconcentration of even natural remedies. Know your boundaries and when to seek medical care. High fever sustained, severe pain, worsening symptoms are red flags. Medical evaluation is essential. Always be cautious with children, pregnant women, chronic disease, or concurrent medications. If you're finding this helpful so far, feel free to like this video. It lets us know this content is valuable to you. Part 2. Colds, coughs, and respiratory support. When you feel the first twinge of a cold, A. Steam inhalation and/or warm humidification. Boil water, place face over bowl, carefully. Breathe in the vapor, cover with towel. Add a few drops of essential oils, eucalyptus, thyme, or herbs, rosemary, peppermint, if safe and non-irritating. B. Saltwater gargle and/or saline rinse. Dissolve 1/2 teaspoon of salt in 1 cup of warm water. Gargle or sip and swish. Helps soothe throat, reduce viral load. C. Warm herbal teas and/or decoctions. Mix ginger, lemon, and honey, licorice root in moderation, elderflower, elderberry, peppermint. Use as hot infusions. Steep 10 to 15 minutes and drink warm, often. D. Chest compress and/or poultice. A warm, wet cloth, soaked in hot water, placed over chest, covered by dry down layer. Or herbal poultices. Mix mashed onion and garlic. Mustard packs, to be used cautiously for short duration. Helps promote circulation, loosen congestion. E. Garlic, onion, turmeric, inside and out. Crushed garlic or onion. Add small amount in warm drinks or soups. Turmeric in milk or water, known anti-inflammatory properties. Cut an onion in pieces, 2 to 4. Place each piece in each room of your home and change every 2 days. Placing a cut onion next to your bed at night is an old folk remedy, often claimed to absorb toxins, purify the air, and improve sleep or congestion. F. Rest, hydration, sleep. Drinking plenty of fluids, warm water, herbal teas. Avoid cold or dry air. Use humidifiers. Early rest to allow immune support. G. Elderberry syrup and/or echinacea. Serve as immune supportive herbs to be used in moderate, safe doses when symptoms begin. Precautions and when to escalate. If shortness of breath, chest pain, persistent high fever more than 3 days, thick green phlegm, or symptoms worsen, see medical professional. Be cautious with herbs if you have asthma, allergies, or are on medications. If you have a family remedy for colds that's worked well for you, you're warmly invited to share it in the comments. Your experience may help others. Part 3. Digestive complaints. Indigestion, bloating, diarrhea, constipation. Digestive discomfort is one of the most common signals the body uses to say, "Slow down, adjust, support me." Indigestion, bloating, diarrhea, or constipation are not random problems. They are often signs of irritation, imbalance, dehydration, stress, or poor food combinations. The good news? For mild to moderate digestive complaints, the body usually responds very well to simple, natural support, especially when we work with digestion, not against it. In this section, we will explore gentle home remedies that help soothe, rebalance, and restore digestive function safely and naturally. A. Indigestion, heartburn, and upset stomach. When digestion feels heavy, burning, or uncomfortable, the goal is to calm irritation, stimulate gentle digestion, and protect the stomach lining. Natural supports. 1. Ginger tea. Fresh ginger slices steeped in hot water help reduce nausea, improve digestion, and calm stomach spasms. 2. Cumin, fennel, or caraway infusion. Lightly crushed seeds steeped in warm water reduce fermentation and ease digestive pressure. 3. Slippery elm or marshmallow root slurry. Mixed with water, these coat and soothe the digestive lining, ideal for irritation or acid discomfort. 4. Baking soda. To be used short-term only, 1/2 to 1 teaspoon in water may help neutralize acid occasionally, not for daily use. 5. Food adjustments. Avoid heavy, greasy, spicy foods. Choose warm, simple, easy-to-digest meals. B. Bloating and gas. Bloating often comes from slow digestion, air trapping, or food intolerance. Natural supports. 1. Peppermint tea or capsules if tolerated. Relaxes intestinal muscles and allows trapped gas to move. 2. Chamomile tea. Calms inflammation and nervous system-related bloating. 3. Activated charcoal. For intermittent use only. Helps absorb excess gas. 4. Gentle abdominal massage and walking. Movement encourages intestinal flow and gas release. C. Mild and short-term diarrhea. Diarrhea is often the body's way of clearing irritation or imbalance. The focus is hydration, soothing, and temporary dietary rest. Natural supports. 1. Brat diet. Banana, rice, applesauce, toast. Gentle and binding. 2. chamomile, raspberry leaf, or geranium tea. Calm the intestines and reduce irritation. 3. Homemade electrolyte drink. Mix water, a pinch of salt, and small amount of sugar. 4. Avoid temporarily dairy, caffeine, raw foods, and greasy meals until recovery. D. Constipation and sluggish bowels. Constipation usually reflects dehydration, low fiber, or lack of movement, not weakness. Natural supports. 1. Warm prune juice or stewed prunes. 2. Soaked flaxseed mixed into water or porridge. 3. Warm water with lemon to be taken first thing in the morning. 4. Gentle abdominal massage and walking. 5. Gradual fiber increase. Vegetables and whole grains slowly, not suddenly. 6. Hydration is essential. Water is non-negotiable for bowel movement. E. Important precautions. 1. In case of persistent bleeding, unexplained weight loss, severe pain, or long-term digestive symptoms, consult a physician. 2. Use herbal laxatives, for example, senna, with caution. Avoid long-term use. 3. Natural does not mean unlimited moderation. Matters. If digestive health is something you struggle with often, consider saving this video so you can return to these sections whenever you need them. Part 4. Skin, wounds, and inflammation. Cuts, burns, bites, rashes, joint and muscle pain. The skin is not just a protective barrier. It is a living, intelligent organ designed to repair, regenerate, and defend itself. Most minor skin injuries and inflammatory conditions respond very well to early, gentle, and appropriate care. When we clean properly, soothe inflammation, and protect healing tissue, the body often does the rest naturally. In this section, we focus on safe, time-tested home remedies for mild skin injuries and inflammation, while clearly identifying when professional care is necessary. A. Minor cuts, abrasions, and scrapes. For small wounds, the priorities are cleaning, preventing infection, and keeping tissue moist but protected. Natural care steps. 1. Clean immediately with clean water or saline to remove dirt and debris. 2. Apply aloe vera gel or fresh aloe sap. Soothes irritation, cools the skin, and supports tissue repair. 3. Apply raw, unprocessed honey. Acts as a natural antimicrobial while maintaining a moist, healing environment. 4. Cover with a breathable dressing. Change daily or, if wet and/or dirty, to support clean healing. B. For mild and superficial burns only. Burns require fast cooling, followed by gentle protection. Natural care steps. 1. Immediately cool the area under cool running water for 10 to 20 minutes. Avoid ice. Extreme cold can worsen tissue damage. 2. After cooling, apply aloe vera gel, raw honey, calendula salve. Cover lightly with a clean, non-stick dressing to protect healing skin. C. Insect bites, stings, and itching. The goal is to reduce inflammation, calm itching, and prevent scratching. Natural supports. 1. Apply baking soda paste. Baking soda mixed with water helps neutralize irritation and reduce itching. 2. Apply oatmeal bath or colloidal oatmeal, deeply soothing to inflamed skin. 3. Apply plantain leaf poultice if available, traditionally used to draw out irritation. 4. Apply lavender or tea tree essential oil, always diluted, is calming and mildly antiseptic. 5. Apply cold compress, reduces swelling and discomfort. D. Eczema, rashes, and mild dermatitis. Chronic irritation often reflects barrier damage or triggers, not weakness of the skin. Natural care approach. 1. Apply oatmeal or colloidal oatmeal baths. Calm itching and inflammation. 2. Apply moisturizers, coconut oil, calendula cream, or chamomile compresses help restore the skin barrier. 3. Avoid triggers, harsh soaps, synthetic fragrances, chemical detergents. 4. Wear breathable fabrics. Cotton or natural fibers reduce irritation. 5. Maintain hydration, both internally and externally. E. Joint and muscle soreness, inflammation. Inflammation in muscles and joints responds best to heat, circulation, and rest. Natural supports. 1. Apply warm compresses or hot packs. Relax muscles and improve blood flow. 2. Topical applications. Arnica gel, comfrey poultices, or low-concentration capsaicin cream. 3. Gentle stretching and rest. Movement without strain supports recovery. 4. Turmeric for internal use may support systemic inflammation balance. 5. Contrast baths. Alternating warm and cool water to stimulate circulation. Important precautions. Seek medical care immediately for 1. Deep wounds. 2. Signs of infection, spreading redness, pus, increasing pain. 3. Serious burns. 4. Strong allergic reactions. 5. Essential oils must always be diluted. Perform a small patch test before wider use. 6. Natural care supports healing. It does not replace emergency treatment when needed. These skin remedies are simple, but consistency matters. If you'd like more videos focused on natural skincare, let us know in the comments. Part 5. Sleep, stress, and nervous system support. Restful sleep and a calm nervous system are not luxuries. They are essential foundations for healing, immunity, and emotional balance. When stress accumulates and sleep is disrupted, the body struggles to repair, regulate hormones, and recover. This section focuses on simple, evening-based practices that help signal safety to the nervous system and gently prepare the body for rest. A. Bedtime routine and sleep environment. Consistency and environment strongly influence sleep quality. Support your body by 1. Keeping a regular sleep and wake schedule, even on weekends. 2. Creating a cool, dark, and quiet bedroom. 3. Reducing stimulation in the evening. 4. Avoid screens and bright lights at least 1 hour before bed. Instead, dim the lights and allow the body's natural sleep hormones to rise. 5. Gentle activities such as light stretching, slow movements, or quiet relaxation help signal to the nervous system that it is safe to unwind. B. Calming herbal teas in the evening. 1. Herbs are traditionally used to promote relaxation and ease mental tension. Common evening options include chamomile, lemon balm, lavender, passion flower. 2. Prepare them as a warm infusion. Steep herbs for about 10 minutes. Drink 30 minutes before bedtime, slowly and mindfully. Warm liquids themselves help promote comfort and calm. C. Magnesium salt baths and/or Epsom salt soaks. 1. Warm baths help relax muscles and quiet the nervous system. Add 1 to 2 cups of Epsom salts to a warm bath. Soak for 20 to 30 minutes, breathing slowly. 2. This practice is often used to ease muscle tension, reduce restlessness, support relaxation before sleep. D. Aromatherapy and gentle essential oils. Certain scents are associated with relaxation and emotional grounding. Commonly used options: lavender, bergamot, vetiver. Use safely by adding a few drops to a diffuser or diluting and applying lightly to the chest or pillow. Always use minimal amounts and avoid irritation. E. Breathing and relaxation techniques. Slow breathing directly signals calm to the nervous system. Helpful practices include deep belly breathing, the 4-7-8 breathing method, progressive muscle relaxation, gentle meditation or visualization. Even 5 to 10 minutes can significantly reduce stress and prepare the body for sleep. F. Warm milk, honey, and nutmeg is traditional comfort drink. In many traditions, a warm drink before bed is used for comfort and relaxation. Warm milk mixed with a small amount of honey, a pinch of nutmeg, very small quantity. This may promote a soothing bedtime ritual. Use cautiously, especially if lactose intolerant or sensitive. E. Precautions and when to seek support. Natural sleep supports have limits. 1. Seek professional guidance if insomnia lasts several nights in a row, sleep loss causes daytime fatigue or impairment, anxiety or stress feels overwhelming. 2. Be cautious with herbal sedatives if you are taking medications or combining multiple calming substances. If you're listening to this in the evening, consider letting this be your cue to slow down tonight. And if relaxation content like this helps you, subscribing ensures you don't miss future sessions. Part 6. Immune and gentle detox support. The immune system works best when the body is well-nourished, well-hydrated, and not overloaded. Rather than aggressive cleansing, this section focuses on gentle, supportive practices that help the body's natural elimination systems function efficiently. The goal is to support, not force, detoxification, allowing the liver, kidneys, lymphatic system, skin, and digestive tract to do their work naturally. A. Warm lemon water in the morning. Starting the day with warm fluids helps gently wake up the digestive system. Drink a glass of warm water with fresh lemon juice first thing in the morning. This practice supports hydration after sleep, gentle digestive stimulation, natural elimination processes. It is simple, mild, and generally well tolerated. B. Green juices and vegetable broths. Fresh plant foods provide nutrients that support immune balance. Options include green juices made from leafy greens, celery, carrots, or cucumber. Use moderate portions. More is not always better. Vegetable broths made with immune-supportive foods such as onion, garlic, parsley, root vegetables. Broths are especially helpful when digestion feels sensitive or energy is low. C. Garlic and onion as daily foods. Garlic and onion are traditional culinary foods valued for their supportive immune properties. Use raw or lightly cooked when possible to preserve beneficial compounds. Include them regularly in meals, not as large doses. Food-based support is usually safer and more sustainable than concentrated supplements. D. Herbal immune tonics, to be used wisely. Some herbs are traditionally used to support immune resilience. Common examples include echinacea, elderberry, astragalus, medicinal mushrooms such as reishi or shiitake, for those who are familiar with and tolerant. Use moderate doses, short-term or seasonal support, with attention to individual tolerance. Herbal tonics are supports, not replacements for medical care. E. Sweating therapies, to be used carefully. Gentle sweating can support circulation and skin elimination. Options may include sauna sessions, steam baths, sauna suits, only if familiar and supervised. Important considerations: hydrate well before and after. Avoid overheating. Stop immediately if dizziness or discomfort occurs. Sweating should feel gentle and restorative, never exhausting. F. Dry brushing and lymphatic support. The lymphatic system relies on movement and gentle stimulation. Use a soft, dry brush before showering. Brush gently toward lymph nodes, toward the heart. This may help support circulation, lymph flow, skin awareness. Pressure should always be light and comfortable. G. Light detox days or gentle fasting. Some people benefit from occasional lighter eating days. Examples: 1 or 2 days of simple foods, soups, broths, or light juices. Key principles: never force fasting, maintain fluid intake, ensure electrolytes and nourishment. Detox days should feel supportive, not draining. Precautions and responsible use. Extra caution is essential if you have chronic illness, metabolic conditions, or take medications. Always remember, overuse of herbal tonics can strain the liver. Combining herbs with medications may cause interactions. When in doubt, consult a qualified health professional. For ongoing immune support and seasonal wellness videos, feel free to turn on notifications after subscribing. Part 7. Women's and men's minor complaints. Certain discomforts are common across different stages of adult life. When symptoms are mild and occasional, simple home-based supports may help improve comfort and quality of life. This section focuses on gentle, supportive measures, not medical treatment. Persistent, severe, or worsening symptoms should always be evaluated by a healthcare professional. A. For women. Minor monthly and urinary discomforts. Some women experience mild menstrual discomfort, water retention, or occasional urinary irritation. The goal of home support is to ease tension, promote circulation, and support comfort. Helpful options may include 1. Herbal support. Ginger tea or chamomile tea to help relax muscles and ease cramping. Parsley tea, to be used occasionally and in moderation for mild water retention. 2. Heat and comfort. Heat packs or hot water bottles placed gently on the lower abdomen. Warmth helps relax muscles and improve blood flow. 3. Mild urinary comfort. Symptoms only. Cranberry juice, unsweetened or D-mannose for mild urinary discomfort, not a treatment for infection. 4. Hormonal support, to be used with caution. Evening primrose oil, chaste tree, Vitex. These should be used only after consultation, especially if cycles are irregular or other conditions are present. B. For men, mild prostate and urinary comfort. As men age, some experience minor urinary or pelvic discomfort related to benign prostate changes. Supportive options may include 1. Plant-based support. Saw palmetto, to be used with moderation. Check for interactions. Pygeum, consult before use. 2. Heat and relaxation. Warm sitz baths to promote circulation and pelvic relaxation. 3. Nutritional support. Pumpkin seeds or pumpkin seed oil, traditionally used for prostate comfort. These approaches are intended for mild symptoms only, not for diagnosis or treatment. C. Supportive habits for both women and men. Daily habits strongly influence pelvic, urinary, and hormonal comfort. Helpful foundations include adequate hydration, fiber-rich foods to support digestion, regular, gentle movement. Additional support, pelvic floor exercises when relevant and properly guided. Avoiding irritants during sensitive periods, such as spicy foods, alcohol, excess caffeine. Small adjustments often make a meaningful difference. D. Important reminders and precautions. These suggestions are for minor, occasional discomfort only. Persistent pain, bleeding, urinary burning, fever, or changes in function require medical evaluation. Herbal supports may interact with medications or underlying conditions. When in doubt, always consult a qualified health professional. If you know someone who could benefit from these gentle, natural approaches, consider sharing this video with them. Sometimes, the right information reaches people at exactly the right time. Part 8. Support for headache, eyes, ears, and nasal discomfort. Discomfort affecting the head, eyes, ears, or sinuses can feel overwhelming, even when symptoms are mild. When irritation is temporary and non-severe, simple home-based measures may help reduce tension and promote comfort. The goal here is to soothe irritated tissues, reduce sensory overload, and support natural drainage and relaxation, not to mask serious symptoms. A. Headache and mild migraine support. Mild headaches are often linked to tension, dehydration, sensory overload, or muscle tightness. Helpful supportive measures include 1. Rest and sensory reduction. Rest in a quiet, darkened room. Reduce exposure to screens, bright lights, and strong smells. 2. Cooling and soothing. Apply a cool cloth or cold compress to the forehead or temples. 3. Gentle plant support. Peppermint oil or lavender oil diluted and applied gently to the temples. Ginger tea or warm decoction, which may help ease tension. 4. Foundational support, adequate hydration. Magnesium, if appropriate and tolerated, avoid known triggers such as bright lights, loud noise, or strong odors. B. Sinus and nasal congestion support. Sinus congestion is often related to inflammation, dryness, or thick mucus. Supportive options include 1. Moisture and rinsing. Saline nasal rinse or neti pot using sterile or distilled water only. 2. Warm steam. Steam inhalation with menthol or eucalyptus, if tolerated, helps loosen mucus and ease pressure. 3. External warmth. Warm compress placed gently over the sinus areas. 4. Traditional comfort measures. Garlic or onion slices placed near the pillow at night, traditional practice. Horseradish or mustard poultices applied externally for very short periods and monitored closely. C. Ear congestion and mild ear discomfort. Ear pressure or mild discomfort may accompany sinus congestion or jaw tension. Supportive measures include 1. Warmth and relaxation. Warm compress applied behind or around the ear. 2. Gentle massage. Light massage around the jaw, neck, and ear area to reduce tension. 3. Traditional oil support, to be used with extreme caution. Garlic-infused olive oil, slightly warm, 1 or 2 drops only. Mullein oil, diluted. 4. Only use eardrops if the eardrum is intact. Avoid any drops if there is discharge, sharp pain, or suspected perforation. Avoid getting water into the ear until discomfort resolves. D. Eye irritation and redness. Eye irritation may result from dryness, fatigue, allergens, or strain. Gentle support includes 1. Cleansing and moisture. Sterile saline eye wash to rinse irritants. 2. Cooling compresses. Chamomile compress or cooled tea bag placed over closed eyes. 3. Oil support, optional, with care. A very small amount of sterile castor oil applied to the lower eyelid. 4. Rest and protection. Avoid rubbing the eyes. Limit screen exposure. Rest the eyes in low light. E. Precautions and when to seek urgent care. Immediate medical attention is required if you experience sudden or severe vision changes, ear discharge or bleeding, intense or worsening pain, fever, neurological symptoms, or persistent symptoms. Be extremely cautious with ear or eye drops if injury or infection is suspected. Home remedies are supportive only, not a substitute for medical care. If this video is helping you build a small home care toolkit, give it a like so more people can find it. Part 9. Putting it all together. A daily support plan and practical examples. Natural, home-based healing works best when it is consistent, flexible, and responsive, not rigid or extreme. Rather than using remedies randomly, this section shows how to organize simple supports into a daily rhythm and how to combine them wisely when minor symptoms appear. The goal is to support the body early, gently, and prevent small issues from becoming bigger ones. A simple daily support routine. Think of this routine as a framework, not a strict schedule. You adapt it based on energy, season, and symptoms. 1. Morning. Gentle activation. Begin the day with warm lemon water to rehydrate and gently stimulate digestion. Add gentle movement, stretching, or a short walk to support circulation and lymph flow. 2. Daytime. Nourishment and prevention. Use herbal teas spaced throughout the day for hydration and gentle support. Eat whole, plant-rich foods, prioritizing vegetables, soups, broths, and simple meals. Stay attentive to early signals from the body. At the first sign of discomfort, respond early. Sore throat. Use saltwater gargle. Congestion. Use steam inhalation. Tension. Apply warm compress or poultice. Early support often reduces the need for stronger measures later. 3. Evening. Recovery and nervous system calm. Transition into a bedtime ritual, relaxing herbal tea, warm bath or magnesium soak, breathing or relaxation exercises. Evening routines signal safety to the nervous system and support restorative sleep. B. Case illustrations. How supports work together. These brief examples show how combining small, sensible actions often brings relief without escalation. Case 1. Mild cold in early fall. Early scratchy throat and fatigue. Support to be used. Steam inhalation, garlic-rich soup, warm chest compress, early rest. Result: symptoms ease within days without worsening. Case 2. Digestive upset after a heavy meal. Bloating and discomfort. Support to be used. Ginger tea, peppermint, light vegetable broth, gentle abdominal massage. Result: digestion settles naturally. Case 3. Itchy rash after plant exposure. Mild redness and itching. Support to be used. Oatmeal bath, aloe vera application, cool compresses. Result: irritation calms without further intervention. Case 4. Occasional insomnia. Difficulty falling asleep for several nights. Support used. Chamomile lavender tea, slow breathing exercises, warm evening soak. Result: sleep gradually returns to normal. These examples show that layering modest remedies with rest, nourishment, and awareness often supports recovery, while knowing when to seek medical care remains essential. If you'd like a full series expanding on each of these routines in more depth, let us know. Your feedback guides future videos. Part 10. Cautions, safety, and when to seek help. Natural, home-based remedies can be helpful when used wisely and within clear limits. This final section is essential. It helps you understand when home support is appropriate, when caution is required, and when professional care should never be delayed. 1. Know your limits. Home remedies are intended for mild, short-term discomfort, symptoms that are self-limiting, early or supportive care. They are not meant to replace medical diagnosis, treatment of serious illness, emergency care. If something feels severe, unusual, or rapidly worsening, do not wait. 2. Possible interactions and contraindications. Natural does not always mean risk-free. Be especially cautious if you Take medications such as blood thinners, blood pressure drugs, or diabetes medications. Are pregnant or breastfeeding. Are caring for children or elderly individuals. Have chronic health conditions. Herbs and supplements can interact with medications. When in doubt, check first. If you have allergies, always test a small amount first. Stop immediately if irritation or reaction occurs. 3. Dose, purity, and source matter. How much you use and where it comes from matters greatly. Choose clean, reputable sources for herbs and supplements. Avoid products with unclear labeling or contamination risk. Begin with mild doses and observe how your body responds. Avoid combining many remedies at once. Do not overuse any single remedy for long periods. Gentle support works best when it is measured and intentional. 4. Watch for red flags. Seek medical care promptly if you experience high or persistent fever, worsening or spreading pain, redness or swelling, unexplained weight loss or bleeding, neurological symptoms, confusion, weakness, numbness, severe headache, symptoms that do not improve within a reasonable time frame. Your safety always comes first. 5. Observe, track, and respond. Keeping awareness helps you make better decisions. Notice what symptoms appear, what remedies you use, and how your body responds over time. A simple log can help you recognize patterns, know what works for you, identify when to stop or escalate care. Listening to your body is one of the most valuable skills you can develop. Responsible use of natural remedies is essential. This channel is about education, balance, and wisdom, not extremes. Conclusion. Closing message. Thank you for spending this time with me. I hope this guide has given you practical, gentle, and safe tools to support your health naturally, right in your own home. Remember, nature offers many supportive remedies, but your body, your awareness, and your judgment are your greatest guides. Use wisdom. Use moderation. And whenever symptoms move beyond your comfort level or persist longer than expected, do not hesitate to seek professional care. If you found value here, subscribe for more calm, natural health education. And feel free to share this video with someone you care about. May you be well, comfortable, and confident as you care for yourself and the people you love.